Welcome to our brief presentation on enablers of occupational adaptation during the COVID-19 pandemic, a qualitative comparison of youth with and without disabilities. Youth are particularly susceptible to the economic impacts of the COVID-19 pandemic. They are more likely than adults to hold temporary, non-unionized, casual positions and often work in industries that are considered high risk. The objective of our study was to explore the occupational adaptations during the COVID-19 pandemic among youth with and without disabilities. We used a qualitative design involving in-depth semi-structured interviews and collected and analyzed our data, which was guided by an interpretive descriptive methodology. We recruited youth with and without disabilities by using a purposive sampling strategy within the Greater Toronto Area, which had a high rate of COVID-19 cases. Our sample involved 35 youth with a mean age of 23, 18 that had a disability, and 17 without. The majority of our sample was women and 6 men, 13 of whom were employed and 18 were in school during the pandemic. Our key themes from our findings, our results highlight parallels and some differences between youth with and without disabilities regarding enablers of occupational adaptation during the COVID-19 pandemic, which involved constructing positive supports, protecting from negative experiences and managing health, and modifying occupations. So in looking at the theme of constructing positive supports, we found that most youth interacted with their environment to develop and maintain their occupational identities. Sub-themes included pandemic-related job opportunities, sufficient home office space and resources, flexible schedule through learning and working remotely, and security of pandemic-related government supports. In our next theme, protecting from negative experiences and managing health, enabling youth's occupational adaptation during the pandemic involved protecting their identity and competence from negative consequences. Sub-themes here included gaining knowledge in workplace health and safety, choosing not to work and minimizing the risk of catching the COVID-19 virus, and protecting mental health. And our third theme involved modifying occupations, which included adjusting to changes brought on by the pandemic and reprioritizing occupations such as work, school, or volunteering. So to conclude, our qualitative study explored the enablers of occupational adaptation during the COVID-19 pandemic among youth with and without a disability. Our findings highlight how the concept of occupational adaptation can help to inform efforts to support underrepresented youth who may encounter situations of occupational disruption.